Hello, everyone. My name is Jody Glean, and I am a member of the Greater Toronto Area Alumni Chapter of Delta Sigma Theta Sorority Incorporated. I am also the chair of the chapter's Social Action Committee. We have been embarked on an initiative to help support education and the raising of awareness of allowing us to learn our roles and responsibilities, to learn different ways of navigating certain challenges that Black and racialized community members may be experiencing in different sectors and different institutions. So this is the third installment of the Know Your Rights series. And this particular installment will be focusing on navigating particular challenges in the health and mental health arenas, particularly within the hospital environment. And to support this conversation, I have here with me Jeahlisa Bridgeman, who's a registered social worker, and quite frankly, she's family to me. So Jeahlisa, I'm so excited to have you here. This is such an important topic, particularly as in the city of Toronto. For those of you who may be aware, the first Monday of March, we recognize Black Mental Health Day. And so this is followed by a week long of activities. And so this particular conversation is so very timely. Jeahlisa, I'm excited to learn more from you, to learn more about the different ways within which challenges may be experienced as Black community members may be accessing care within a mental health care, health supports within our hospital environments. So I'm just going to get us kickstarted right away. Okay.
Sounds good. Thank you for having me, Jody.
All right. So let's begin with just a round of introductions. Can you share more about yourself and your entry point in this discussion on accessing mental health resources in the hospitals for Black and racialized persons?
For sure. So I'm a registered social worker. I graduated with my Master of Social Work degree in 2017, where I specialized in health and mental health. And throughout my career, I've basically worked primarily in healthcare, so particularly in the hospital environment, in a variety of different departments and inpatient units and outpatient settings. So I've had the privilege of supporting individuals of all ages. That included, children, adolescents, adults and young adults, and seniors. The breadth of my experience, I would say, has been supporting adults living with chronic health conditions. And I've seen a lot of comorbid mental health challenges that accompany those type of diagnoses. In terms of, I guess, my experience with Black and racialized persons, working within a diverse region of Ontario, a lot of my patients and their families stem from different lived experiences and intersectional identities, which include Black and racialized communities. So as a Black woman working within this context and understanding the impact of race and health outcomes, I always practice from a place of empathy, anti-oppression, anti-racism, anti-Black racism, curiosity, compassion, and trauma-informed care. Outside of my role in the healthcare field, I'm also a part-time psychotherapist in a clinic that represents and supports BIPOC communities. And many of my clients are young adults, Black or racialized, and they're experiencing different mental health challenges related to, different transitions in their life, different life changes, and of course, structural inequities. And outside of my career in general, I'm also a new mom. And so I've been on the patient side. I've been a Black patient in a hospital where I don't see people that look like me or can maybe relate specifically to my experiences. So I can understand on an intimate level what it's like to navigate health and mental health resources as a Black patient.
Thank you so very much. So as you can see, you understand why I invited Jeahlisa to be a part of this conversation. Thank you so much for sharing more about yourself. So give us some context and perspective. What is the landscape of mental health resources being coordinated and provided within the hospital environment? For those who may not know what's there, well, what's sort of the general context of mental health supports in the hospital environment?
For sure. I just want to preface that question by first saying that accessing mental health care in general is just very confusing and frustrating. And I don't think it's any different within the hospital environment. So hospital level mental health care is often reserved, I think, for individuals who are experiencing significant psychiatric symptoms, folks who are in crisis or at risk of immediate or severe harm, or who have significant addiction or concurrent disorders. And by concurrent, I'm meaning mental health and like addiction or substance use concerns at the same time. So, navigating or accessing mental health resources within a hospital setting usually looks like stabilization of like really severe symptoms, decreasing, any safety issues or risks, and crisis intervention. And that typically takes place in the emergency department, if needed, or if beds are available. Sometimes that's looking like admission to an inpatient setting, or referrals to outpatient hospital-based clinics or partial hospitalization programs. So, I mean, there's definitely some benefits to being able to access mental health within a hospital setting, because it could lead to easier access to a multidisciplinary team, or psychiatrist for diagnosis and like medication support. There's oftentimes, I find, like a faster turnaround of referrals for specialists or for the medical team, or even for community-based resources. There is sometimes, I think, a level of treatment that's a bit more intense, and that's really to ensure stabilization. I just think that there might be easier, faster access to certain supports. But I also want to note too that some individuals, or a lot of individuals, I should say, have both mood and comorbid chronic issues rather than just mood issues alone. So sometimes what that looks like is, someone will come into the hospital for their physical health, and mental health conditions can emerge, or it can be highlighted during that process. What can complicate that experience, though, is that sometimes physical illness can mask, or can overlap, I guess, with mental health symptoms. So, if there's a chronic condition where fatigue is a huge component of that piece, there's definitely mental health conditions as well too that could also have fatigue as a part of their symptom profile. So for individuals who are accessing hospital level care for acute changes to their health or a challenge related to a chronic condition, sometimes there can be a referral to psychiatry for assessment. That's only if the mental health condition, I think, is pertinent. There are social workers or discharge planners that are present in inpatient and outpatient settings, but oftentimes that support is really brief or very solution focused. And it's more so on connecting folks to like tangible resources that will kind of safely get them out of the hospital environment. So things like ongoing mental health support, or the opportunity for skill development, I think is sort of limited within that scope.
Thank you. Thank you for providing such a comprehensive overview of the type of supports and navigations that folks can access and expect within the hospital environment. Okay. COVID-19 pandemic. So we know that this came in hot and heavy in the past, in 2022, and we know that we're still dealing and managing consequences of the pandemic, and we know that the pandemic compounded the realities of systemic racism in nearly every sector, every corner of our societal life, and that included our healthcare system. All right.
Mm-hmm.
And so with the heightened attention on systemic racism, it has placed many of our institutions under the microscope, especially, of course, our medical institutions. What do you identify as common challenges or barriers Black, racialized community members may be experiencing when navigating mental health supports and programs within the hospital settings? What are some barriers and some challenges in being able to access the support that Black community members may be facing at this time within the hospital environment particularly?
Yeah, for sure. I think there's a number of barriers and challenges. I think one really blatant and possibly obvious one is that there's limited access to practitioners and healthcare providers that look like Black individuals. And I'm speaking from someone who is a Black healthcare provider. There really is a limited number of doctors and nurses, other social workers that look like you as a Black patient or as a racialized patient. And with that comes, I guess, a limited understanding of the nuances of that type of social identity, right? So maybe possibly having to over-explain cultural pieces or over-explain, the impact of your ethnicity or your race on like just certain aspects of self-care or healthcare. I also think that in and of itself can lead to distrust in the system, just due to the historical context, but just in general, like it is hard to feel trustful of a system where people don't look like you. As I mentioned before, mental health resources and just in general healthcare resources and navigating those systems can be really confusing. And there's a lot of jargon and language that just might not be super accessible for individuals. So not knowing what programs or resources that are even out there can cause a significant barrier. I think as well too that again, due to the limited I guess a limited number of people that look like you, there can sometimes be culturally insensitive treatment. And I say that very broadly, but what I basically mean is that a lot of the programming and treatment can be based on like more Eurocentric norms and values. And there's almost like a one size fit all approach. And sometimes it's not tailored to fit a particular person's identity, and which can include race and culture. Microaggressions and stereotyping. I've experienced microaggressions as a Black healthcare provider, so I could only imagine what a Black patient can experience when trying to interact with, healthcare providers. And with mental health challenges, like sometimes it's not presented the same way in racialized people, or at least it's kind of overlooked, maybe minimized, invalidated. I'll never forget that while I was connected with a midwifery clinic, a midwife had mentioned to me that, a Black man who had just lost his baby during the birthing process was grieving. And because of how he was grieving, the other healthcare providers, I guess, were considered him behavioral and scared, and they called a code white. So instead of providing empathy and support during that moment, he was essentially apprehended and, just hurt probably further or just pushed down further during a very low point of his life. So not recognizing, I think, and addressing the mental health challenges can look different in racialized people, and not recognizing that, again, how we experience depression, anxiety might look different than maybe someone who is not Black. And then, of course, I think there's also sometimes a bit of cultural stigma that comes from our own communities, which in and of itself is a barrier to emotional vulnerability, right? Like not understanding the importance of taking care of one's mental health, not recognizing certain symptoms as mental health concerns, and then obviously not accessing care sooner before it gets to a point where it is a bit more impactful on your life.
Okay, thank you. Thank you for sharing some of those clear-cut examples of what anti-Black racism can look like in the navigation and in the as we try to access our mental health supports. Okay. Mm-hmm. So then, with those realities in mind around, what folks may be experiencing, how anti-Black racism may be manifesting in the hospital, healthcare settings and environments, what guidance would you provide Black and racialized persons or clients when they believe they are experiencing racism, whether by an administrator or a counselor, a therapist, a healthcare provider, of these mental health supports within the hospitals? And at the same time, whether it's to the person who's trying to access the care, or maybe they may have family members advocating for them, or support mm-hmm. persons there on their behalf advocating for them within the healthcare settings. Are there particular ways within which, in that context, any guidance you provide if they believe anti-Black racism is impacting the care that their loved ones may be receiving? So asking the same question, but from two varying viewpoints, whether that you are the client themselves and you believe you're experiencing racism, or whether you are a family member, a support person, and you believe anti-Black racism is impacting the care that's being accessed. Do you have any guidance, just from your experience generally, any guidance,
Yeah,
some key tips that community should be aware about?
for sure. So I want to highlight the importance of I like the fact that you asked about the family member piece too, because that is one of the tips that I would encourage people to consider. Um, Bringing a loved one to appointments, to medical appointments, to mental health appointments, if it's possible. I think it's important to have a second pair of ears in these spaces, and not only for just comprehension, because it can be really overwhelming when you got a lot of information, and sometimes you can forget certain things when there's so much information overload. But it also helps for you to kind of gauge and feel out, I think, the environment, and um, just I would say the vibe, with that healthcare practitioner. I also like to just highlight as well too that individuals have a right to make informed decisions and choices. So based on your interaction with that healthcare provider, if you suspect any kind of racism or discrimination, or you feel invalidated, you have a right to ask for a new healthcare provider. You have a right to ask for the manager of the clinic to discuss maybe your concerns with the patient care. Um, you have a right to ask for additional support or for additional treatment options. You can always inquire about whether you can, move to a different provider who can probably just validate you a bit more, and also to not be racist. You have a right to not experience that type of safety while you're trying to navigate health and mental health supports. Um, I also like as well too, just not necessarily if it's not necessarily a racist interaction, but you're still feeling comfortable. I think it's always important to just bring a piece of paper or a notepad so that you can write down and make notes during your appointment, or even create a list of questions prior, which might be helpful. When interacting certain appointments, ask about the benefits and risks related to different treatment options or just to different choices. And don't be afraid to ask for data pertaining to Black individuals, which I think is lacking in of itself. But even asking, the healthcare provider if they've had experience working with, Black or racialized folks, and how, the treatment or whatever program you're in has been helpful for that demographic. And if push comes to shove and things are still feeling uncomfortable, or you really feel that like you've experienced just a really unsafe interaction within the hospital, where you felt diminished or you felt invalidated, and uh, quite frankly overt racism, don't hesitate to connect with patient relations. Like, that's why that office is there. It's meant to support patients who have experienced questionable interactions with healthcare providers.
Thank you. Thank you for sharing that. I was this particular week, within this context, there was a bit of information in the news recently from the Ombudsman's office of the province indicating, I believe it was well over 3,000 complaints last year that came from patients about the type of treatment, the insensitivity, and what they deem to be disrespectful treatment within the hospital healthcare environment. So again, we know that racism is real. We know that race plays a part in our interactions, our day-to-day. So Jeahlisa, thank you for sharing those concrete examples and tips of where you can go, things you can do to equip yourselves within those spaces as you're accessing care or supporting someone who's accessing care. So Jeahlisa, thank you so much for that. Kind of want to flip the attention on the other side of the coin, so to speak. So as a practitioner within the hospital environment, and you had mentioned within community as well, what are some key reminders you want to share with the counselors, with the social workers, with the administrators, with the therapists, about what they need to do or integrate into their practice to ensure that they are providing comprehensive support to Black community members, to our racialized community members on broadly? What are some things that can be done in practice? What would you say to your colleagues in the field?
For sure. I think before I even address my colleagues in the field, like, I do want to highlight the leadership and administrator piece, because I do think that two important things should happen or need to happen, and it's been beaten to the ground. It's been said multiple times, but I think race-based data on patients accessing health and mental health services within Ontario needs to happen. I think it's important to have that information so that there's a better understanding of health disparities. There is research to suggest that there is systemic racism, and it obviously is having a real impact on patients and Black individuals and racialized folks. But we need additional data to validate that, and that will help, I think, create more equitable services. Services that are geared more specifically to particular demographics and that really take into account some of the disparities that exist. I also think there needs to be an increase in representation of Black staff in mental health spaces. I think there is familiarity or there's comfort in familiarity, and just being able to see a social worker or a psychiatrist or someone else, or like any kind of mental health worker that look like you, can really help, I think, decrease some of that stigma around accessing certain services, and can also just increase comfort and just support people, as they journey through like a very intimidating and overwhelming experience at times. In terms of my colleagues, to my non-Black colleagues, I think it's always important to continue to be educated, to understand the impact of race, to understand the impact of culture, and to actually just do the work and not just kind of rely on like your Black colleague or your racialized colleague to like explain everything to you. Go out there, attend workshops, read books, learn about anti-oppression, anti-racism, anti-Black racism, and if anything, just listen, validate and listen, and create emotional safety. Understanding that, there might be some distrust, which might present as non-adherence or or an unwillingness to engage and with you. And it's not necessarily because that person doesn't want to access treatment, it's because they don't feel safe in this environment. So just kind of questioning and finding out ways how you can make this a safer experience for patients, I think can help, increase or improve, the experiences of Black individuals accessing health and mental health services in Ontario. And I also say to my Black colleagues, because again, as like myself, there are Black people that are in these spaces, and it is exhausting at times to work in these systems, because you are working in a system that has its flaws and have embedded systemic racism. And then also too, sometimes you are burdened with being the educator or the voice or the face for that organization or for that environment. So for my Black colleagues who are having to navigate, that space, like sometimes it's just important to rest and to acknowledge when you're feeling burnt out and to take care of yourself, because if you're burnt out, you're not able to provide the level of care that you need for patients in general, but especially our Black patients who already have a hard time navigating these type of systems. So just prioritize your rest and prioritize your own mental health as you work for a system that can be oppressive to people that look like you at times, making sure that you're taking care of yourself during that entire process.
Ooh, well, my cup runneth over. That was fantastic. Thank you so much for sharing such important resources, thoughts, tips, tools, and strategies on so many different ways and levels for folks who are within this space, whether they're accessing care or they're the ones providing care. As we come to an end, because I'm actually at the end of the questions, I do want to, and in the spirit of Black Mental Health Week and raising awareness of it, I want to ask you, what brings you joy in your work, Jeahlisa? How do you center joy in this practice? Talk to me. What does that look like for you?
Um, Honestly, I find joy in just listening to the stories of all of my patients. I think that's why I entered this field. Um, I think it's such a privilege and such a blessing to walk with people along their journeys. Even though that journey can be incredibly difficult, especially, when you're working with chronic disease or with chronic mental health conditions. But just to see those small improvements, or those small skills being developed, or a smile on your patient's face because you've been able to kind of connect them with a resource that they had difficulty connecting with, or just giving them that opportunity to be vulnerable and to let out some of um, just the challenges that they're experiencing. That is what gives me joy. This work can be really tough emotionally, um, and at the same time, there are just so many things that I learned from my own patients and from my own clients, that just make it so worthwhile and so impactful for even my own life. So I think it's just a privilege to walk along with other people and to guide them through difficult transitions, and to also see them kind of come out on the other end, and be resilient, or uh, just get through really hard experiences and survive, that experience. I think is so important. So I think that's what kind of gives me joy.
That's awesome. Thank you. And thank you to all of you for tuning in and for sharing this particular video. The Know Your Rights series is really meant to just connect in with our local expertise, with professionals, with academics, with folks who are embedded in the different systems that we have to navigate on a day-to-day. So if you know folks who may be accessing care, mental health supports within the hospital environments, if you know of anyone who may benefit from hearing some of these lessons learned that Jeahlisa has shared with us, please feel free to share this video. Jeahlisa, thank you for sharing your time and your talents with the community today. Thank you so very much.
Thank you, Jody. I'm really honored that you asked me. So I really appreciate it.
Absolutely. All right, everybody, take care. Thanks so much.